So imagine you've got a patient sitting right in front of you in the clinic. Opening a conversation with this exact question, it is incredibly powerful. You see, it sets the foundation for really safe, non-judgmental healthcare. You aren't accusing them of anything, you're actually partnering with them. And honestly, in today's medical landscape, that partnership is absolutely crucial.
Welcome to this explainer. Today, we're going to uncover exactly how healthcare professionals safely bridge the gap between traditional therapies and modern conventional medicine. We'll be diving deep into the clinical frameworks and ethical guidelines that make sure patients get the absolute best and safest of both worlds. Here's our agenda for today's explainer. We're going to cover the reality of integration, defining the care models, the safety triage system, the four-lens framework, and we'll wrap up with ethics and cultural humility. All right, let's jump right into section 1, the reality of integration and care models. To really understand how traditional treatments and conventional medicine interact out there in the real world, we kind of need to clear up what these buzzwords actually mean. The difference between these terms is vital. Take a look at complementary care. This is purely supportive. It's used together with conventional medicine, and it's generally safe, provided the practitioner screens for interactions. But then, look at alternative care. This is when a therapy is used instead of conventional care, and that is a massive safety concern if it delays or outright replaces life-saving evidence-based treatments. Finally, we've got integrative care, which is really the gold standard. It's an optimal model of coordinated, patient-centered care that combines both approaches while always prioritizing safety and evidence. Moving on to section 2, the communication protocol. Patients often hide the fact that they're using traditional therapies because they're terrified of being judged or dismissed. But if a patient is afraid to tell you what they're taking, you literally can't keep them safe. That's why practitioners need this structured 4-step protocol. It empowers the patient to speak up. First up, open questioning. Just like our hook at the beginning, you ask non-judgmentally. Second, you've got to get the specifics, the exact species, the brand, the dosage. Third, you want to understand the context, like why are they using it? Are they trying to replace a prescribed medication? And fourth, meticulous documentation. You write it all down and screen for any dangerous herb-drug interactions. And guys, this isn't just some theoretical exercise. In incredibly diverse places like Malaysia, this blending of Malay, Chinese, Indian, and indigenous health traditions is just a daily clinical reality. Patients already blending these systems at home, which means the modern healthcare system has to adapt to actually understand and safely monitor this pluralistic approach. Which brings us to section 3, the safety triage system. The big takeaway here is that not all complementary practices carry the same amount of risk, right? A clinician obviously can't treat a mild cup of herbal tea the same way they treat an invasive physical procedure. By dividing treatments into risk levels, practitioners know exactly how to react. A lower risk practice, like a relaxation massage, just needs some basic monitoring to support safe self-care. A moderate risk scenario might involve an unregistered commercial product or a vulnerable patient, like a young child or a senior citizen. That demands detailed product checks. But a high-risk concern? That's when you see medical red flags or the patient wants to stop essential treatments. That requires an immediate stop to the traditional intervention and an urgent hospital referral. Basically, this triage system prevents tragedies. Let's see how this works in practice. Section 4, the four-lens framework and the case of Mr. Tan. Let's take those abstract rules and apply them to a literal life-or-death situation using what's called the four-lens framework. Put yourself in the clinician's shoes for a second. Mr. Tan comes in with his daughter. He's 62, a stroke survivor, and he's on strong blood thinners. His daughter tells you that an unregistered practitioner told him to stop taking his blood thinners so he can get deep acupuncture, bloodletting cupping, and take high-dose herbal extracts for his severe knee pain. They are sitting in your clinic right now asking for your approval. So what do? Well, this is exactly where the four-lens framework becomes invaluable. By looking at Mr. Tan's request through these 4 specific lenses, your path forward becomes crystal clear. First up, evidence. There is zero evidence to support unmonitored stopping of blood thinners, and doing so carries a massive risk of another stroke. Second, safety. Deep needling and bloodletting while someone is on warfarin, that risks a fatal hemorrhage. Third, culture. You can't just coldly dismiss them. You really have to respectfully validate the family's compassionate desire to relieve his chronic pain. And fourth, regulation. Under Malaysian law, specifically Act 775, unregistered practitioners who perform invasive bloodletting are violating legal standards. Taking all 4 of those lenses into account, you can craft a response just like this one. It perfectly demonstrates how to communicate. Notice how it starts with deep empathy.
I completely understand how deeply you care. But then, boom, you draw a firm, non-negotiable safety boundary. However, stopping warfarin is extremely dangerous. Finally, you don't just leave him hanging, you offer a coordinated, safe alternative by referring him to a licensed physical therapist. It's just a brilliant balance of compassion and uncompromising clinical safety.
And finally, Section 5, Ethics and Cultural Humility.
Managing complex, high-stakes cases like Mr. Tan's doesn't just happen by accident, right? It requires a rock-solid foundation in bioethics and a genuine understanding of the patient's background. These right here are the 4 pillars of bioethics, and they guide every single decision in integrative healthcare. You've got autonomy, which is respecting the patient's informed choices; beneficence, which means doing good; justice, providing fair care to everyone. But in integrative medicine, the absolute loudest principle is often non-maleficence. First, do no harm. That means actively protecting your patients from unsafe remedies, unsterile practices, dangerous drug interactions, or anything that delays a proper medical diagnosis.
Now, to truly respect a patient, practitioners need both of these concepts on the screen, but they are actually very different things. Cultural competence gives you the baseline textbook knowledge about different ethnic communities, but cultural humility, that's a lifelong practice. It literally means dropping your assumptions, committing to self-evaluation, and genuinely listening to the patient. You have to view them as the ultimate expert on their own cultural experience and values. Ultimately, evidence-informed care isn't just about staring at lab results or throwing clinical trial data at a patient. It is a really delicate balancing act. It's about integrating the best available research with clinical expertise while completely respecting what the patient values. And it requires immense professional integrity, meaning you honestly communicate clinical uncertainties and you never, ever promise unproven, guaranteed cures for serious diseases. As integration shifts from being just a neat idea to the absolute reality of modern healthcare, this is the question every healthcare provider and, honestly, every single patient needs to be thinking about. How do we best protect lives while deeply honoring the traditions and treatments that people value most? Thank you so much for joining me for this explainer. Keep questioning, keep learning, and I'll see you next time.